Thank you for the opportunity to speak with you again, this time on the current phase 3 studies of opevesostat in metastatic CRPC. This drug is also known as MK-5684 and for a long time as ODM-208. So I will discuss these two phase 3 studies of opevesostat in patients with metastatic CRPC, so the Omaha 003 and Omaha 004 study. Similar presentations have been presented previously by Dr. Yu, Dr. Fizazi, and Dr. Gratsky. So activating mutations in the androgen receptor are a common mechanism of resistance to AR-directed therapies. And as previously noted, the prevalence increases after treatment with novel hormonal therapy agents. These mutated androgen receptors may bind to other ligands. So as Dr. Garmezi presented in one of his slides, those other ligands may be progesterones, corticosteroids that could stimulate the androgen receptor pathway. Therefore, targeting adrenal androgen synthesis further upstream may provide a therapeutic advantage over the currently available NHA therapies. Opevesostat is a first-in-class anti-hormonal agent that might offer an alternative post-NHA option to overcome drug resistance. So opevesostat inhibits selectively CYP11A1, and this is the first and rate-limiting enzyme of steroid biosynthesis. Opevesostat suppresses the production of all steroid hormones and precursors that may activate the AR signaling pathway. This inhibition leads to a deficiency in all adrenal hormones, including not only androgens, but glucocorticoids and mineralocorticoids. Therefore, replacement therapy with glucocorticoid and mineralocorticoid is required concurrently with opevesostat treatment. This is the CYP11A1 study, which is a phase 1 and phase 2 expansion study, which evaluated opevesostat in men with extensively pretreated metastatic CRPC and androgen receptor ligand binding domain mutations. And in this study, the androgen receptor ligand binding domain mutations were tested by Guardant 360. The phase 2 study cohort included a total of 134 patients, of whom 66 were androgen receptor LBD mutation positive, and 68 were wild type. The median age of patients were 68.3 years in the overall population. And among patients in the mutation positive and negative groups, 53% and 34% respectively received both abiraterone and enzalutamide. Almost 100% of both groups received prior docetaxel, and 64% and 56% respectively received prior cabazitaxel, so heavily pretreated group. The treatment with opevesostat led to PSA and radiographic responses in both tumors with the AR-LBD activating mutations and also in the wild type population. However, there were higher rates of response in those with the AR mutations. The number of men with prolonged disease control, defined as duration of treatment greater than 6 months, appears similar to both groups, but the data is still premature. So word on safety, in the phase 1 study, adrenal insufficiency occurred in about 1/3 of the study participants. Therefore, in the second phase 2 expansion, opevesostat was given in conjunction with dexamethasone and fludrocortisone, and also at lower doses of opevesostat compared to the phase 1 escalation dose. And with routine glucocorticoid and mineralocorticoid administration, opevesostat was reasonably well tolerated, with low incidence of SAEs related to adrenal suppression. It notes 3% there. In the most updated ESMO 2024 data, that percent is 5%, but in general, still a very low rate of SAEs. There were no grade 5 events related to drug. In the phase 3 study protocols, the dexamethasone and fludrocortisone are continuing to be incorporated in the treatment arm. And they have incorporated also extensive patient education, emergency kits, patient ID cards that have important information for when patients have acute illness or need to go to the ER or get admitted for care. Right. So the Omaha 003 study, it's an open label phase 3 study evaluating opevesostat versus alternative novel hormonal agent in metastatic CRPC patients in the post-NHA, post-taxane setting. Patients are unselected for androgen receptor LBD mutations. However, that is one of the stratification factors. And the primary endpoints are overall survival in the overall population and radiographic progression-free survival in the overall population. And similarly, the Omaha 004 study is similarly designed open label phase 3 study evaluating this opevesostat versus alternative NHA in a pre-taxane population. Prior docetaxel in the metastatic HSPC setting is allowed, provided no more than 6 cycles of docetaxel were given and no progression on prior docetaxel. And these studies are currently open and enrolling internationally. Thank you very much.